People ask you all the time when you move out of day-to-day clinical medicine into an administrative position, don't you miss it? And you do. But as a statewide health policy maker, Georgia's got, over 10 million citizens. And obviously we've got a lot of healthcare challenges. And it's very rewarding to be able to feel like you're making a difference for millions of people's lives rather than just, hundreds or even thousands that you would in a medical practice.
The thing that's impressive about Dean is that he's not interested in the status quo. He wants to move things forward, and that's a very difficult position to take in rural healthcare in our state right now. But it has not deterred him at all.
I think the beauty of him wearing the Senate coat, the physician coat, and the community coat is that he understands the needs of the people and of the patient.
You can't flip a switch in Atlanta and make things better in a very rural, poverty-stricken area, which is very common where I live. To actually improve outcomes, you've got to flip that model, and you have to get in front of individual patients and make them make changes in their personal lives for them to get better.
He has such a passion for the community and the people who live here that his public service is something that he couldn't deny.
I tell people all the time, on our desk we have a red button, which means no, and a green button that means yes. We do not have a yellow button, which means maybe. So you've got to make a call, and every time you push that button, you're making somebody happy and you're making somebody unhappy.
My first impression of Dean Burke was, he's a real snob. It was just his demeanor, just so quiet, so cool, and so knowledgeable. And he'd been a gynecologist too, so he got a lot of bad jokes from the other legislators.
Dean's perspective comes from his career as a physician, and he has a servant's heart. He looks for ways to serve the community that he loves, and it's clear in everything that he does that he loves Southwest Georgia. He loves the rural parts of this state, and he wants to move our state forward.
One of the biggest ways that I felt like I could make a difference is trying to help people understand the real focus of healthcare policy needs to be on improving healthcare outcomes.
When Dr. Dean Burke came on board, he was the only physician in the Senate.
It was just a weird sensation to have people come up to me and ask me how they should vote on a healthcare issue when they didn't know me from Adam and I just walked in the room. And to me, that told me how much of a healthcare vacuum there was.
When rural hospitals were struggling, and yet the state, from a financial standpoint, was doing all it could, he looked for a different way. And the Georgia Rural Hospital Tax Credit has been a game changer for hospitals like ours and approximately 60 other hospitals around the state who are benefiting from that program today.
Whether it's at the Senate or whether it's at the hospital, when somebody calls, it impacts a patient. And I think that's why he does such a good job with that, because that's what matters to him.
If you can't listen, then you're not going to be successful, because the only way to find out what somebody's problems are is to hear what they have to say.
Being a physician, the quality of care was of utmost importance to him. We've seen that through his maternal mortality emphasis in his role as senator.
We passed a bill that set up the Maternal Mortality Review Committee, and they're studying each one of our maternal deaths to see what went wrong. And since then, we've been able to put some money in the budget for treating maternal hemorrhage. So we're focusing our appropriations on where the data tells us our problems are, rather than just throwing a bunch of money at something and hoping it sticks.
In this past session, he spent countless hours on legislation that dealt with the certificate of need.
A lot of people that are very smart and good people had completely different ideas about what Georgia should do, and trying to work through those issues in a way that's not personal, that's policy driven, is just challenging.
Negotiations are really hot and heavy sometimes. Sometimes he says, "Oh, Freddie, I'm so exhausted." I said, "Keep going, keep going."
At the end, I think we struck a very good balance of kind of modernizing our certificate of need process while keeping the proper balance to protect hospitals that are safety net or rural facilities that are at risk if we get it wrong.
No matter where you live, no matter where you work, no matter who you are, no matter what race, gender, we all need quality access to health care.
Dean is receiving the Distinguished Service Award from the Georgia Hospital Association because he truly deserves it. He serves with distinction no matter what he does.
Dean is such a, I'm going to say, quiet disciple, because he certainly is somebody who is not seeking the spotlight.
He is patient-centered, and we need more people like that. Instead of getting caught up in policy and money, I think we need to think about people, because that's why we do what we do every day.
I can't think of another individual with his credentials that has done so much for the medical community, for people and healthcare over the last decade. And I'm just so proud to know him, proud to call him my friend and my colleague.